Hello friends, welcome to Cortex YouTube channel. In this video, I am going to discuss about scores that predict the cirrhosis in case of CLD, chronic liver disease patients. So, there are so many non-invasive methods to predict fibrosis or to test for cirrhosis in patients with chronic liver disease. Some of the scores which are proposed and they are well documented, well validated to predict the cirrhosis are there are so many scores are there. Let us discuss a few popular one and easy to calculate one. First one is your APRI, sorry, APRI. What does it mean? It is nothing but AST2 platelet ratio index. It stands for AST2 platelet ratio index. That is your APRI. So it's simple. It is a simple tool to just to predict cirrhosis in patients with CLD. It's how simple is. It just needs only two parameters. That is your AST and platelet. That's it. So let's look at the formula to calculate APRI. APRI is calculated by you just need AST, the patient's value divided by upper limit of the normal and platelet count. It is expressed in 10 to the power of 9 cells per liter. Okay, so into 100, if you do this, you will get APRI score. If APRI score is more than 1, it is suggestive of advanced fibrosis. If APRI score is more than 1.5, it is suggestive of cirrhosis. Okay, so how to calculate? Let us take an example. Let's suppose AST of a patient is 80 and normal value is 40 and platelet count is 80. So if you do simple math, you will get 2 by 80, that is 200 by 80, that is 20 by 80. 20 by 80 means 2.5. 2.5 is obviously more than 1.5. So here the patient is having cirrhosis. Don't worry, I will explain with the real life cases. Here you just remember this is a easy to calculate example. So I took here second score. Let's discuss about second score. That is about your APRI. Second score is also a very simple score. That is your FIB4 score. Here it uses an extra 4 parameters. Those are your age, AST, ALT and your platelet count. So how to calculate this? It's also very simple. Age into AST value, obviously patient's AST value, divided by platelet count into the square root of ALT. So if the calculated score is more than 3.25, it is suggestive of cirrhosis. So how to you will take one example and we will explain this. Let's suppose age of the patient is 56-year-old and AST is around 80, platelet count is also around 80 and the ALT value is around 64. So let's calculate this. 56, this 80 gone. So 56 divided by root of 64 means 8. So 56 by 8 means it is 7, which is obviously more than 3.25. So obviously there is a cirrhosis. Okay, there are other, again one more score for predicting cirrhosis is Bard score, which uses very simple form, which for parameters they are BMI, which is more than 2.8 carries 1 score, and AST to ALT ratio, which is more than 0.8 carries 2 scores, and history of diabetes mellitus carries 1 score. So if the Bard score is more than or equal to the odds ratio of predicting AF is more than 17. So advanced fibrosis. AF means advanced fibrosis. So these are the few handy tools to predict fibrosis in cases of CLD. So there are so many other scores like your Fons index, log index, and there are other so many indexes like NAFLD, fibrosis score, and HEPA score, HALT C score. So many are there. In this, these are very important and they are very easy to calculate. So one is APRI, second one is FIB4, third one is BARD score. Okay, now with a real life example, let us calculate the, this is your CBC of a patient to look for platelet count, and this is your LFT. So what we need is, the age of this patient is, the age of the patient is 36. Okay, so what are the parameters we need? Age, AST to ALT. AST is how much is the AST? 68. ALT is 42. Platelet count is 72,000. Okay, 72,000. We need that much only. 72,000. Okay. So let's calculate APRI. So if you calculate APRI, how much it comes? APRI is nothing but AST. Patient AST is how much? 68. Upper limit of normal, how much they have given here? 50. Okay, let's take it as 50. Platelet count is 72 into 100. So if you do it, how much it will come? 68 divided by 50. Sorry, 68 divided by 50 is 1.36, which into 100, that is 136. Okay, we'll take it as 136 divided by 72. So 136 divided by 72 means 1.8, which is obviously more than 1.5. So there is cirrhosis. I'll show you the ultrasound also there, which says there is cirrhosis. Okay, let's apply FIB4 for this patient. Age is 36 into, what is the formula for FIB4? Yeah, let's recall. What's the formula for FIB4? FIB4, age into AST divided platelet into root of ALT. Age into AST. AST is how much? 68. Platelet count is how much? 72. Root of 42. ALT is 42. Okay. If you apply this, how much it will come? So 36 into 68, 2448 divided by 72 into root of 42. Root of 42 means how much? It is 6.48. Okay, 6.48 into 72 is 466.5. So 2448 divided by 466.5 is your 5.24, obviously, which is more than 3.25. So there is cirrhosis. This is also telling cirrhosis. APRI score is also telling cirrhosis. And if I show you the ultrasound report, that will also show there is chronic liver parenchymal disease, cirrhosis. So ideally for the other we do fibroscan, that is your ultrasound elastography, that will also not just detect the fibrosis and cirrhosis, that will also grade how much is like F1, F2, F3 and all. So it measures liver stiffness. So there is chronic liver parenchymal disease. So one more, that is these are the non-invasive methods or scores to predict the cirrhosis in patients. See, the presence of thrombocytopenia in this patient tells that there is portal hypertension and this is less than 80. So there is a risk factor. There is a risk for varicose bleeding. So if I show his endoscopy, you will see there are small and large esophageal varices. Where is that endoscopy report? It's there in that. Okay. This patient's endoscopy showed there are varices, large esophageal varices. Okay. Hope you like this video. If you found this video informative, please like, share and subscribe to the channel. Thank you.